Welcome to the webinar. Hopefully we'll get everybody back to work within 11 minutes. It's on the evolution of life-saving technology. My name is Ryan Perkins, and I work at the Ackerman Cancer Center. We're going to talk about a little bit of the evolution and history of protons. So a long time ago, the proton was made. Who made it? Well, we don't know. Greeks would have said it was Zeus. Others would have claimed it would have been Mother Nature. However, it was in 1815 when William Prout, who was a chemist, physician, and theologian, he came up with Prout's hypothesis, which was that all atoms are composed of hydrogen atoms, and he called these basic units protiles. And then when you fast forward 80 years, we had the first medical application of ionizing radiation. These are all independent events. And then in 1903, Henry Bragg, who was a physicist, chemist, and sportsman, he was doing experiments on charged particles. And he noted that there was energy loss of a charged particle increase just before the particle came to rest. If you see the graph on the lower right, you can see that there was a peak. And that'll be important for proton therapy. In 1911, Ernest Rutherford, who was a New Zealander and father of nuclear physics, he discovered the nucleus. In 1911, 6 years later, he actually split the atom, and in the process of that division, discovered the proton. That particular particle, in 1920, at an international meeting, was asked, what is it going to be named? And that's when he named it the proton. A lot of work was done on atomic matter and also on atoms and other elements. And sometimes these elements can prove disastrous, as did the Hindenburg disaster when a spark ignited hydrogen gas. And so to control these particles, a lot of work was done. In 1934, Dr. Ernest Lawrence, who was a physicist, he got his PhD at Yale. He was actually working on the Manhattan Project during World War II, and when World War II ended, continued to pursue his career in physics, and he invented the cyclotron, which takes charged particles and accelerates them outward from the center along a spiral path. You can see in the bottom left corner of a depiction of what that is like. The middle picture shows in 1939 a 60-inch cyclotron that was producing particles up to 16 MeV. And in 1946, Robert Wilson, who was a protege of Dr. Lawrence, Dr. Wilson received his PhD at Berkeley and was actually instrumental in working on that same cyclotron. He understood the importance of that Bragg peak. He understood the importance of protons, particularly in their ability to treat patients differently and better than conventional photon radiation. And he published that in the article, Radiological Use of Fast Protons. In 1954 was the first time they used proton therapy, and it was used to treat the pituitary gland for hormone suppression in metastatic breast cancer. Prior to that, animals had been treated, but not people, and now people were beginning to be treated. In 1957 in Sweden, as developments continued on, they knew that they wanted to treat more than just a single point. And they figured out how to spread out that Bragg peak. And if you see the graph on the right-hand side, it shows that on that plateau, that if you fit a tumor within that plateau, it's then treated with a uniform amount of radiation while minimizing dose to the surrounding tissues. Over the next 30 years, proton therapy was pretty much an academic treatment. And it was used for doing things for atoms and atomic experiments, and not many people were treated. As more and more people got treated with proton therapy, and I saw some advantages to it, It wasn't until 1990 when Loma Linda became the first hospital-based treatment center with proton therapy. James Slater started that. I actually interviewed with Dr. Slater back in 1990, just before this center opened. It's still open today, and they continue to do marvelous work and research on proton therapy. And protons, what makes them different is it allows us to give higher doses of radiation to destroy tumors, minimizing dose to surrounding healthy tissue. As you can see on the pictograph on the bottom left, with regular photon beam, it penetrates all the way through the body, whereas on the right, with proton beam, it stops. But when patients come to see me, they're not seeing me to talk about protons and Bragg peaks and cyclotrons. They're coming because they've got something that they need help with, that they need something fixed, they need hope. I was going to give 3 examples of that. The first is breast cancer. In breast cancer, conventional radiation therapy on the left treats a mild to moderate amount of heart and lung while addressing the breast cancer, versus you see on the right, proton therapy treats just the breast itself, minimizing dose to heart and lung. I had a young lady who came in to see us. She had had a previous mastectomy and reconstruction, followed by chemotherapy. Several years later, the cancer recurred. It was then resected, and it was then recommended that she receive radiation therapy treatments. Conventional radiation, if you look at the bottom left, shows that it does treat the breast well, but if you look at the blue line, as it comes through here and that red line, it treats a significant amount of her heart and lung. And that's just because of the way that her body is shaped. Had she been treated with conventional treatments, she would have ended up with significant cardiovascular disease in the future, risk of cardiac death, and congestive heart failure. As you can see on the right, the proton beam nicely conforms to the shape of the reconstructed breast and chest while minimizing dose to heart and lung. And we anticipate that she will have minimal side effects to those underlying tissues. Similarly, lung cancer, as you see the pictograph on the left, shows a nice conformal beam of radiation to the tumor with minimal dose to the surrounding tissues. The regular photon radiation, which is central in this slide, shows that we are able to treat that area of the lung, but you'll notice that there is a lot of medium to moderate dose within the rest of the chest, encompassing heart, right lung, and left lung, which could contribute in the future not only to lung but also to heart disease as well. I had a patient who came to see me. She had a previous lung surgery with a right lower lobectomy. She then received chemotherapy followed by standard radiation therapy. Approximately 5 years later, in a routine evaluation, she was noted to have a new mass that was biopsied and came back as a cancer adjacent to her original cancer. Her surgeon said that he was unable to operate. She went to see her radiation oncologist, and he ran a treatment plan, and it demonstrated that there was a significant amount of radiation that would be delivered to her lungs and heart, which was felt to be too toxic, and did not recommend any additional radiation therapy. Thus, she really had no other treatment options for this. She came to see us to see if proton could possibly be her treatment. As you see the pictograph on the left, this shows that the tumor area is able to be addressed, but you can see these spikes of radiation that correspond to the radiation exiting through lung, heart, and other organs, whereas the proton beam on the right lower side shows a nice conformal beam, minimizing dose to lung, minimizing dose to heart, and this became her treatment of choice, and she was able to be treated successfully with this. And lastly, I had a gal that saw me in her mid-80s. She went to see her primary care doctor with pain in her shoulder, and an MRI scan was ordered and showed that she had a meningioma within the spinal canal. They said that she was inoperable due to her age and medical condition, and that her prognosis was terrible with worsening pain and possible spinal cord injury. She came to us in desperation looking for any kind of a treatment, and we saw her and recommended proton beam therapy for her. And as you can see, this is a cross-section through the neck that the proton is able to address the tumor, which is right on the edge of the spinal canal, minimizing dose to spinal cord and maximizing dose to the tumor. And so when it comes to radiation therapy, using proton beam therapy, what it really gives you is a chance for success, a chance for life, a chance for hope. Benefits: proton therapy reduces risk of damage to normal tissue, secondary malignancies, and side effects of traditional radiation. Thank you very much. If you have any questions, please submit them.